I'm Dr. Jackie Gardner-Nix. I founded the program many, many years ago and have taken a lot of patients in the health system through this program. So I'm delighted that others are learning to facilitate the program and that we're growing in our knowledge. But let's start by even defining what we think mindfulness is for somebody who's just heard the word, but they don't really know what that word means. So Debbie, Lisa, who would like to jump in with that? You want to go first, Debbie?
I will, thank you. Mindfulness, what I've learned about mindfulness over the years is the ability to be able to focus on what is going on in the moment without judgment and without trying to change things. That's been my experience and is my experience of mindfulness.
Okay. It sounds so simple, and yet we didn't do it actually before we were formally trained at mindfulness very much at all. So it is actually a different way of being, to use this awareness several times a day to just be and not be judging at the same time as well. Lisa, do you want to add?
Mhm. Yeah, I absolutely agree with Debbie. And also, it has, I think, a lot to do with your attitude, and you did touch on that as well. And it's just bringing a beginner's mind to our experience, to what's happening in our mind and in our body. And we start to have this connection between our mind and body, which we didn't realize that we've had before, and also a connection to our environment. And that really flows into our daily life and how we live our daily life through mindfulness. So attitudes of kindness towards ourselves, yes, non-judgmental attitude when we're looking at our feelings, our emotions, the state of our mind and our body, and bringing that into everyday life and moments.
Yeah, and towards other people as well. We suspend judging more around others and how they're acting life. And I think we move closer to understanding that we're all different, and that if someone else is acting differently to the way we would act in their situation, it's not wrong, it's just different. And that actually seems to stress our bodies out so much less when we are able to be more open to others' experiences as well. The thing I like too about mindfulness is how, as we continue to practice it, our awareness opens up more discernment, so that we're able to understand more about how this body works, how this mind works, and how it connects with everything going on around us in such a way that we're able to take more, I think, wise decisions about what's best for us, and understand more about the connection between our environment, the people we meet, and how we feel, and how sick we might get or how well we might get from those interactions. That way we've got a chance to mitigate some of the fallout that might occur if we were not so aware.
That's right. I also love the
Sorry.
element.
Go ahead. Yeah.
The element with mindfulness is that trust that things change, that our pain experience changes, our emotional experience changes. So it's not always fixed and static. And I think the more mindful we are in regards to the mind and our body and our daily experiences, life has an ease to it, because we know it's not always going to be this way. It may be more intense, but it may be a little bit less too. And then when we begin to trust in that, it begins to, we have a trust that won't be this challenging all the time, right?
Right.
I would like to add to that, in that being a chronic pain sufferer, what I've come to learn through mindfulness is that chronic pain is transitory. It is not a solid thing, and it goes together with the mind-body connection. So being able to see that it's transitory really helps with the pain.
Yeah, it does, doesn't it? And we don't want those with chronic pain to feel that what we're saying here is that chronic pain is something that is very temporary, because that's not what you really mean, is it, Debbie? It's that it fluctuates. It fluctuates. And it also fluctuates tremendously with the context we're in at any one moment. So if we're very stressed or if we're very sleep deprived, it can be quite destructive to our feelings of this. It's always going to be this way. It's always going to be this intense. I'm suffering so badly. But actually, if one can see that at this moment, it's really intense, but it's not going to stay this way. Even in the next moments, even in 10 minutes, things will change. And being open too, I had to be open with the fact that I have migraines that were quite stress related and yet have a very biological basis. But I had to be open to making sure I paced my life better. I made better choices. I ensured that I did the best I could to keep them less frequent. And that came with awareness and self-care. And all these things are what we learn in these courses.
I think that's really paramount, is the self-care and learning about self-care. How do we care for ourselves, right? And that is a very hard thing for a lot of people. The importance of who they are and what their experiences is, and how unique everybody's experience is in chronic pain or emotional pain, and how can we take care of ourselves. And you said, just like, even looking back and referring, how did I take care of myself before with my migraine? What helped before? And sometimes it might be environmental, it might be eliminating a stress in our life, it might be examining a relationship in our life, or it can be as simple as, at this moment, I had to accept and have a cup of tea and close my eyes and have a blanket for self-nurturing. So we learn as we go what helps.
Yeah. Debbie, what would you add?
What I would add to that is that with chronic pain, it's not always about, for me, about getting rid of the pain. It's about having this awareness, this mindfulness, as another tool to help with the pain. And by bringing awareness to it, we're no longer shunning it and pushing it away, which can make it worse. By bringing the mindfulness to the awareness to the chronic pain, it allows us to be able to work with it.
Yeah, I often used to say in the courses, collaborate with it. The pain's a message, it's trying to tell us something. And even though it's become chronic, and it's kind of going around and around and not really going away like we normally should heal, it is still giving us a message. And I've actually seen quite a few instances of people changing the circumstances of their lives. It might be a relationship, or it might be where they live, or something, or their job, actually. Yeah, that's a big one. Changing their job to do something that aligns with them better, and the pain is so much better as a result of making some of those changes. And by the way, I'm not putting down the role of medication either, but it allows us to sort out what needs to be in our tool belt or our basket because of the enhanced awareness, so that we can make the decision as to which meds are helping, which medications we need to have at our disposal, so we can have a collaborative discussion with our healthcare professionals who are prescribing them. And also which other things need to be in that basket that are not medication related. It could be going to lunch with friends on a regular basis. It could be certain self-care things that we haven't been doing. It could be sleep hygiene tips that we haven't been using, or it could be meditation, which I think, regularly once a day for me is very important, that I always have that. The same as brushing my teeth, I would always need my meditation time each day, and not long either. Some days it's 20 minutes and some days it's 40 minutes for me. Other things to add?
Yeah, if I can, I wanted to go back to what Debbie had said too, in regards to living with the pain. And it almost becomes less of a fight against it. It's not, you are working, like you said, Jackie, in collaboration with it. And how can I live, not necessarily peacefully, but how can I have a different relationship with my pain, so that I can live in a different way with that. right? Instead of fighting, because we know that when emotionally we're fighting against something, that still has that direct effect on our body, right? And that tightening around that pain and that protection around that pain. So I think that can be really helpful. And I think also part of this course is education, and education is so powerful. And I think it can be very empowering for people to learn the techniques and start to take a bit more control and maybe ask a little bit more questions surrounding their experiences. And that in itself, you know, research has shown that education can certainly help to eliminate that context of pain.
Yeah, there's certainly some research that's shown that once we are trained in mindfulness, uh, there can be less contacts with healthcare professionals. So it's kind of good economically for the health budgets, if we have more people who are trained in mindfulness, because they become more discerning about the connection between why pain's exacerbated or why an illness has gotten worse, and that can sort of like, although it's annoying and upsetting when that happens, if you know the connection to why, like for example, every holiday around December time, it may get worse because your routines change, because you're meeting more people that might be difficult to meet up with around family scenarios, etc. So if we know that we could kind of expect that that may exacerbate, we can also do some decision making to ensure that we reduce those chances. We can decide that we can't really have a gathering at our place this year unless people bring potluck. Then maybe it'll work. But we've seen many people going through the courses that have been able to figure that sort of thing out and actually become accepting of the fact that they can't be Superman or Superwoman anymore, and they need to ask for a bit more help, and that's okay.
It helps to relieve us of a lot of guilt that we have towards ourselves, because a lot of times we find that we feel that we're being selfish in sort of stepping up and taking care of ourselves. And many people aren't always happy with that because they notice this change within us and we're not following the same pattern that we've stuck with for years. And so just being able to make that choice without, like for me, mindfulness is always about choice, and to make the choice that fits well for ourselves,
Yes.
and not always.
Mm-hmm.
Absolutely, absolutely. We can also make choices when we stretch ourselves intentionally and say, okay, I'm going to sacrifice this because this is important to me, but I know I'll have more pain. But somehow when we make the choice and we have control over that, the pain may not feel as intrusive, or we may not suffer as much when we know we made that choice.
That's right. And I think too, we learn what we can control and what we cannot control. And when we can live within what we can control and acknowledge that maybe other people's opinions of us and our self-care, we can't control that, but we can control our feelings about our self-care and the importance of that self-care. And that too gives us that power, right?
Yes.
It's just a learning process.
Yeah, it's interesting to think that with the awareness and the discernment that we acquire through this practice, that we can actually begin to see more skillfully when pain is about to ramp up, or when a panic attack is about to happen, or a PTSD, post-traumatic stress disorder attack is coming on. And in that discernment, begin to understand where we can interrupt it at maybe, step 2 of a rapid set of steps that usually gets us into the stratosphere of suffering. So that comes later, I think, and it's through practice that we can get that skilled. It does require that commitment to doing the meditation on a regular basis and acquiring those attitudes of mindfulness. Any last things that you want to add?
Well, when we were talking about meditation, and I think sometimes that when people come into learning about meditation, and we can have a whole discussion just on that, but is I think just learning there's going to be good days, there's going to be days where it's a challenge, and each one is a learning experience. And lots of people will say, I can't focus, I can't meditate. But I think through this process, we learn the nature of the mind and what our mind is designed to do. And we're able to celebrate that when our mind wanders and we come back, and learning that the practice is truly the coming back and remembering that, you know, we had strayed. And I would just want people just to be aware of that, and that just to come in with this open, fresh mind, like we say, beginner's mind, and not a, I can't do that, or it's always been a challenge, but just to experience it in a different way of acceptance of whatever happens during that moment, and that's okay.
I think a lot of people think that meditation is emptying the mind. But what we've just described is that meditation is formal mindfulness, where we put some time aside to actually practice the skill of being in the present moment with intention, with awareness, and without judgment. And it's really just that practice. And our mind is trained to go off on tangents and to go to the future or past. So as you pointed out, just noticing where it's gone to and then bringing it back is actually the art of meditating.
Right.
It's not failing meditating, it's
No,
actually meditating.
Right,
Yeah.
right.
So
I think in response to Lisa, what you said is that one of the most important things that I learned was that the mind's job is to think. And so in meditating, just to, you know, to not try to force it to stop thinking, just to bring it all into the moment. And so this is what's going on in each moment, no matter what it is, without, you know, putting it as negative or positive, keeping it maybe more neutral, and just seeing what it does, you know.
yeah, it's interesting too. When I first encountered the education in mindfulness in 2001 is when I first trained, that I recognized that I'd seen it being practiced somewhere naturally, and it was in my palliative patients who didn't have much time to live. And that was where, you know, all of a sudden the awareness of the present moment became very valuable for them. I think we've also seen it naturally recently in lockdowns as well, in the pandemic, that the lockdowns have, I guess, taken away so much of the chaos and interference and busyness of life for people who weren't, of course, battling in the hospitals to keep things going. But those people who were in their homes were now actually beginning to see what it was like to be disabled and in your home because of disability, or disabled through PTSD and not being able to go outside the home. So there was more of an understanding of what it was like to actually be in a home, and yet the outside was also very quiet. The roads were quiet, and there was more ability to actually pay attention, to notice the mundane. And that was more similar to what we do in mindfulness than it's ever been. And there's been reports that, for example, in the veterans space, that some post-traumatic growth took place as a result of having that quiet time. And potentially, I think also maybe because they were feeling that the civilians were being exposed to trauma in a way that the veterans had felt was only their piece, their trauma. So there was a sense of more people sharing in their experience through the pandemic. So yeah, so let's leave it there. And I'm just going to say, you know, people signing up for your course will certainly get riches by doing it. And it's also very nice, isn't it, from a facilitator perspective, to know that we are moving people forward in their healthfulness, in their ability to have a slightly different life after doing this work, and a life that, while it's slightly different at the beginning, becomes very different as they progress in very positive ways, and also ripples towards family and friends in a very positive way, so that their health, like secondhand smoke as it were, but their health actually gets better. I'm using secondhand smoke as a metaphor where it doesn't get better, but in this way, this kind of mindfulness secondhand smoke seems to help everybody in a very positive way.
I'd just like to add to that as well, Jackie, that I think Debbie and I really value creating a safer environment for people. So people that are anxious to come into a situation, we try our best to hold people where they're at and nurture them. But as much as it's a learning experience for the participants, it's a learning experience for us. It's a journey we all go on together. So and just in Debbie and I talking, I think that's really of great value in how this course would be run.
Yes, I absolutely agree. Last word from you, Debbie?
I'm just really excited.
Yeah. It's lovely running these courses and working with a group of people who gradually change over just even those few weeks of the course. And then it's almost like releasing them into the environment to fly. Yes, absolutely.
It is very rewarding, very rewarding.
Yeah. Okay. Thank you.
Thank you.
Welcome. Thank you.